Welcome to everyone, and welcome to the third session of today's technical symposium. My name is Suja Rishikesh Mavroidis, and I'm director at the WTO's Market Access Division. So getting right into the nitty-gritty of things, the objectives of this session really are to determine what is the status of work in identifying the critical inputs to produce COVID-19 vaccines. Secondly, it's to explore the bottlenecks that have been experienced by stakeholders in cross-border trade of such inputs. And third, learn what policy options have worked well in facilitating trade of vaccine inputs. And I think we already got a sense of that in the earlier session, which I thought was terrific and very informative. During the initial phases of vaccine production, the manufacturers were using inputs largely sourced from the same country. However, as production has scaled up and manufacturing begins in other countries, international trade is going to play an increasingly important role in moving vaccine inputs across borders. Thus, the question is, what can be done to ensure that trade in those critical vaccine inputs is as smooth as possible, so as to ensure the fastest possible scaling up of production? So this session will deal with three critical aspects of this important question. First, customs and other border agencies involved in the clearance of exports, imports, or transit need to know which are those products for which trade has to be facilitated. And the more they know, the more likely they can be given priority treatment. Second, we need to better understand whether there are bottlenecks in moving those critical vaccine inputs and the lessons to be learned. And third, we need to look actually at the other side of the coin, which is to see what has worked well in facilitating trade. So these best practices can then be better understood and emulated by others wanting to facilitate trade in those critical inputs. So we are extremely honored to have very distinguished panelists for this session who will be discussing these three main questions. I won't be going into any details into their biodata. It's available on the event website, but I'm sure they're already well known to all of you. The first group of speakers will focus on the identification of the products, while the second group will then turn to the identification of trade barriers and best practices in facilitating trade for these products. To respect the time allocated for all speakers, we kindly ask that your interventions are limited to no more than 5 minutes, and I thank you in advance for your cooperation. And I would also very much encourage questions through the chat box. We will try and address them after the first round of initial interventions, time permitting. But before getting into the speakers list, we do have two speakers from the WTO Secretariat who would like to give a little bit the lay of the land in respect of the subject. So with great pleasure, I pass the floor to Dayong, he's the chief of the Market Access Intelligence section of the Economic Research and Statistics Division at the WTO, and to Mr. Roy Santana, who is the counselor at the Market Access Division. So Dayong and Roy, you have the floor. Thank you.
Hello. Thank you, Suja. Hello, everyone. Let me start. Let me share my screen first. Okay, let me start with some figures on global value chain, global vaccine production, based on the data provided by Airfinity. The left chart is the status by mid-June, and the right is the projection for the end of this year. So far, about 3 billion doses have been produced by 28 production facilities in 17 countries. By the end of the year, the production capacity will possibly scale up to 10 billion, which will be produced in more than 60 production sites located in about 30 countries and regions. As you can see from the charts, both scale and complexity of the vaccine network will significantly increase in the coming months. Clearly, this will require some adjustment to the existing supply chain and cross-border trade. With the production scaling up in many countries in a short period of time, the stable and reliable supply of vaccine inputs will be essential. As no country can produce everything needed, manufacturers, especially the new producer, will heavily rely on the international suppliers to source manufacturing inputs. This would require supply chain not only scale up quickly, but also to deliver those products from one country to another efficiently. Therefore, for governments, the question is how to facilitate cross-border trade to ensure the smooth movement of critical products. To have a targeted policy response, it is always important for policymakers and border authorities to know exactly what these critical products are, as well as their correct custom classifications. To address this need, the WTO team has initiated a project to identify the critical inputs required for vaccine manufacturing. Thanks for the contribution from many speakers of this symposium. We have been able to compile at least about 80 critical products with corresponding 70 indicative HS classifications. These products have been mapped into different parts of the supply chain, including manufacturing, storage and distribution, and vaccine administration. For manufacturing inputs, we have subcategories for ingredients, consumable material, production equipment, and packaging supplies. We hope this product list can assist the government and customer authorities to facilitate monitoring trade of vaccine inputs. And we also hope that these could be helpful for manufacturers to optimize their supply chain operations. This joint work will be maintained as a living list, which will be updated and adjusted according to the new knowledge and new needs. The list will be released after this symposium. Here are some trade statistics for selected vaccine inputs. You can see that imports have increased sharply since the end of 2020 in those vaccine producing countries. With more production facilities become operational, we would not be surprised to see similar import surge in many other countries. By the way, I have to note that there is not always enough granularity in the trade data to monitoring all critical inputs, because some products do not have specific codes in national tariff or statistical nomenclatures. There is also an urgent need for international cooperation in compiling relative statistics to get comparable data between countries. We also have assessed a tariff faced by those products. As you can see from the charts, the tariff on active ingredients, manufacturing equipment are relatively low, but there are still categories facing relatively high tariff, for example, close to 10%. Also, the tariff among countries could be quite different. For example, tariff on storage and distribution, for some countries, the tariff could be 32%. Obviously, an immediate policy response from the governments could be cutting the tariffs to help to reduce manufacturing cost. Now I give the floor to Roy. Thank you.
Thank you very much, Dayong. Perhaps I think you need to stop your, and then I can begin mine. Thank you very much. So Dayong was explaining how the supply chains for producing vaccines are going to start relying more and more in terms of international trade to move these inputs around and then be able to produce in places that we are not currently producing. So international trade is becoming even more important in these supply chains. Now, the issue with trade policy is it can either facilitate or it can actually slow down this manufacturing process. And the question is, what do we do if we want to make sure that we are a bit like the adrenaline in terms of making it faster and avoid being like the bad cholesterol that slows down the flow of those goods? We have quite a lot of knowledge in respect of this. We know that there are several different trade facilitating measures that can be applied. In fact, many members have already been applying many of these trade facilitating measures to facilitate import of some of these critical inputs. And when it comes to vaccines, it's exactly the same issue. It's relatively easy to move them around. Some, or at least many of the measures that can be applied are covered by the Agreement on Trade Facilitation and are quite well known. Things like, for example, strengthening pre-arrival procedures, having authorized operator type of operations, simplifying the procedures and so on, having more transparency. And I think some of the speakers have already made reference to some of them. One point I wanted to make here, however, is that if you really want to facilitate trade, perhaps you need to look also beyond the measures that you have in the Trade Facilitating Agreement. And in fact, we have a publication that was issued last year that explores many of these different measures that have been implemented across different areas to try to simplify and expedite procedures and moving trade of these goods around the world. For example, there have been many documented cases of countries that have completely eliminated tariffs. They have also eliminated internal taxes and other duties and charges on the movement of these goods. There have also been simplification of certain types of procedures which are not necessarily associated with customs. And I think one element which is quite important to bear in mind here is that customs is a very important player, but it's not the only border agency that may play an important role in facilitating the movement of these goods. In a typical country, you can have up to 35 border agencies that can play a very important role in allowing the clearance and the release of these goods to be as smooth and efficient as possible. Now, as Suja mentioned in the introduction, the question is, which are the products that should be facilitated and for whom? So I think there is an important information gap here also that has to be solved. And as Dayong was mentioning, we have been working hard in producing this list to try to help the different stakeholders to understand in a common language what is it exactly that needs to be facilitated. We did an experiment. We actually compared the information we have in this joint indicative list, and we compared that information with the trade measures that have been compiled in the context of the trade monitoring exercise. And I'm just going to tell you very briefly what kind of information we have. From what we can see, we have at least 32 economies that seem to be restricting trade on or exports on at least of one of these inputs. It can be more than that. Most of them seem to be caught by some of these export bans that have been put in place, but there are also export licensing schemes that may be affecting the movement of some of these products. In terms of the products, most of the products that we have identified in the joint indicative list are subject to at least one of these export restrictions. Now, one point I like to stress here is we are not saying that trade is necessary in these inputs is necessarily being affected, but at least some of the figures suggest that this may be the case. So this is something that needs to be explored in a bit more detail. In terms of the trade facilitating measures, the last majority of these have been introduced since the last year. There are of many different kinds. Many of these measures, if they intend to simplify procedures, they typically apply to all products. However, you also have some like elimination of taxes, establishing of green channels, and so on and so forth, that tend to be product specific. So again, this is why it's important to know which exactly are those products that may need to be facilitated. From the information we have available, approximately 43 economies have temporarily eliminated tariffs on at least one or more of these products that are covered by the list. About 8 economies have temporarily eliminated internal taxes. Typically, we're talking about VAT. And we have at least 4 economies that have also temporarily eliminated some form of import licensing procedure to allow these goods to move faster. Now, in terms of the bottlenecks, so we have been trying to talk not only in terms of gathering information from what we have in the WTO. If you want to know what the problems are, you really need to go to the people who are experiencing those problems. So you need to talk to the companies. And this is what we have been trying to do through this symposium and also through some other mechanisms like the COVAX Manufacturing Task Force to try to understand better where is it that some of those problems are. We intend also to have a living list like the one we have for the product, but I just wanted to give you an idea of some of the measures. One issue, for example, is that while vaccines are greatly facilitated when they come to customs, many of these inputs are not. And if I can give an example, one of the previous speakers mentioned some plastic caps. Well, if you don't have those plastic caps in the manufacturing facility, you can probably have to stop production of the vaccines. And then once they go through customs, probably people don't really realize how important they are for this vaccine manufacturing, right? So giving them some form of priority seems to be important. Also, many of the testing that is done is often undertaken in very specialized laboratories. In some cases, you have only 1 or 2 laboratories in the world that can do the proper testing for purposes of quality controls, for example. But then once you need to move that sample from one country into the place where that laboratory is located, sometimes these samples are being caught by either export restrictions or they are subject to exactly the same type of procedures and then therefore there are some delays. I'm not gonna go into the details. You're gonna be able to see this once we distribute the slides. I just wanted to leave you with a few ideas for possible action because I think the problems are quite recurrent. We already know what they are. And I think this issue of establishing a communication channel with the private sector, with the manufacturers is quite important. And we already have one mechanism, which is the National Committee on Trade Facilitation that can serve as one of those possible channels where you can explore what are the conditions, whether there are some measures that can be expedited, best practices, how to improve the, let's say, monitoring of the trade data, and so on and so forth. And also just to say, or conclude by saying that there are also, in terms of international cooperation, some additional actions that do not necessarily require reaching some form of international agreement, but that can play a very important role in facilitating and monitoring what exactly is going with trade in these inputs. Apologies, I think I exceeded a little bit my time. Thank you very much, and I'll be happy to answer questions as necessary.
Yes, well, thank you, Dayong and Roy. I noticed some of the terms that you'd use, such as granularity of products and the various measures in terms of trade policy responses, which I thought was very useful for the next session. And of course, this symposium will play a key role in fostering more collaboration amongst different stakeholders. That's part of the purpose of the symposium. And of course, to continue updating this document actually that you'd refer to, which is like this living document of critical products or inputs for vaccines. I will now like to turn to the first group of speakers who will discuss precisely this question of the identification of products that are used as inputs in the manufacturing of COVID-19 vaccines. And again, I think Dayong had made a reference to customs being, or both of them had made a reference to customs, of course, being a very important player in this whole supply chain. And with great pleasure, I would like to invite Gael Grooby from the WCO to share her views, as they have certainly done tremendous work since last year on the identification of these different products. So please, Gael, you have the floor.
Thank you very much. And I'm delighted to have this opportunity to actually spend a few minutes just talking about how the WCO is responding to this very practical exercise of mapping cross-border movements of vaccine inputs. Now, the WCO, like customs administrations around the world, is accustomed to working on very real practical issues on a daily basis. So we're bringing this solution-based focus to bear on the issue of keeping vaccine manufacturing supply chains moving. So this means that one of our primary areas of concern is actually understanding the what, who, where, and how, so we can assist our members, that is the customs administrations, to facilitate the movement of essential goods. It's also why in the early stages of the pandemic, the WCO moved quickly to provide indicative lists of essential supplies and collect information on practices in facilitation from our members to help provide a central place for information. Now, my particular area is, of course, the harmonised system, the HS, which is used to classify goods crossing international borders. So this means that my primary concern is the what. In order to facilitate goods, customs need to know what goods need facilitation. So we're currently working along with the WTO and manufacturers as part of the COVAX Manufacturing Task Force Working Group on free flow of goods. To look at this, and in addition to building up valuable industry connections and cooperation so we can explore problems and develop solutions together, we're working on a particular product, as Roy mentioned. We're currently working on a list of critical supplies, and this will give information on what exactly these goods are, and also information on how these goods are currently flowing across borders. Why? Because working on facilitating specific goods requires clear and objective information on what those priority goods are. And it also requires clear and specific information on what the problems are that they're facing. So this is what we're looking to supply with this list. And one of our next steps at the WCO on this list of goods will be to look at, in consultation with our members, at where they're classified in the HS. We need to ensure that our members agree on classification. This in itself is a critical facilitation measure to ease the import of goods. But of course, classification is only the starting point. Depending on how specific or how broad a classification is, it's usually not sufficient on its own to identify such specific goods within the broader flow of trade under that provision. So there's usually a need for further information to enable customs to say that out of all the goods that are coming in under a particular HS provision, these are the ones related to vaccine manufacture. But the classification is one of the two basic starting points on which such identification measures can be built. And the list will also enable us to see with greater precision what the current situation is. What are countries already doing in relation to these goods, to these classifications? And as has been pointed out by previous speakers, it's important to remember that most supply chain problems are not necessarily problems with customs processing at the border. More commonly, they relate to supply or logistic problems, or if they're border problems, they can be from other agencies. So we need to start with the question of whether there are problems and what are those problems, and do they fall within the realm of our customs members? So if there are problems with customs processing, what are they? Is it in relation to the declaration of classification, valuation, origin? Is it processing time? Is it in relation to inspections? Different problems require different solutions. And of course, there are some, such as export restrictions, that relate to government policies and are outside the scope of customs administrations to directly address. And then, of course, there is the context and variability. Are these problems only occurring in some countries? If so, what is the current best practice for solving this problem? That is, where it's working well, what are they doing? And developing information and recommendations for our members, knowing what is working well is as important as knowing what is not. And finally, because we're very short on time here, I'll say that the working group and the WCO are looking to the future. Very sadly, it's highly unlikely this will be our last global or near global health emergency. So one of the things we're looking at is what we can learn out of this experience in order to be better prepared for the future. And within the WCO, this will also include supporting the Harmonised System Committee and adapting the HSC to enable it to more clearly identify essential supplies for the pharmaceutical and vaccine industry within its 2027 edition, which has currently been negotiated to help future-proof for future emergencies. So to sum up, as always, the WCO is working to promote practical solutions to real-world issues, and we're dedicated to working cooperatively with members, other organisations and industry to progress this. Thank you.
Thank you very much, Gail. And I should have mentioned that Gail is the Deputy Director of the Tariff and Trade Affairs Directorate at the WCO. And I certainly noticed your point about bringing a very practical focus to this discussion, development of this list, which will be critical. This is responding to the what question that you had highlighted. And also what I found interesting was this notion of getting systems into place to handle future situations, which, as you also pointed out, are probably, unfortunately, very likely to happen. But thank you very much for that. And we are getting questions coming through the chat box, so thank you very much. And we would welcome having even more questions. And so please do feel free to post them there. So we turn now to Silvia Sorescu, who is a trade policy analyst from the OECD, and who has actually authored a paper on identification of some of these products. So Silvia, please, you have the floor.
Thank you very much, Chair, and good morning, good afternoon, good evening to everyone from wherever you are listening in right now. It's really a pleasure to be here with you today, and thank you very much to the WTO for the invitation in this technical symposium. As the OECD, as in other organizations and stakeholders, we have looked at vaccines from an economic perspective. So in our most recent economic outlook, we have seen that prospects for economic recovery depend on the vaccination pace, but also for a longer term, preparing for the future, how to prepare the resilience of supply chains of these different medical goods. So I would like to use this minutes to touch upon 3 areas, aiming to basically highlight why the mapping of the cross-border movement of vaccine inputs is an important yet complex endeavor. So I would like to speak about on getting from lab to jab, so the importance of defining the scope of mapping, getting these inputs across and beyond the border, also on how we could better get from a more snapshot kind of information, anecdotal, to more structured evidence, and the value of transparency in this area. And I would use our most recent work that we have been doing at the OECD in specifically exploring trade interdependencies in vaccines and related inputs. So on getting from lab to jab and defining the scope of mapping, this is of course important because it matters then also to map out the actors. So what are the firms that are producing, where are they located in the value chain, at which level of the value chain, also the policy environment, and of course, how and when supply can respond to that demand. But we have seen the different other presentations that of course we have different types of vaccines, different steps in the manufacturing and distribution. And so thus this means really trying to identify a very wide range of individual items. We are talking about raw materials, chemical ingredients, capital equipment, and so on. And from our work, we have seen that there are really a couple of challenges here. Then the previous speakers again have referred to this. Identifying the right input, nailing down that product scope is not easy. We can use, of course, the language of trade at the harmonized system of 6-digit codes to try to identify internationally what these categories of goods are. But it also means that there are in this HS6 level, maybe other types of products included that are not directly relevant to vaccine production, delivery, or administration. And we can take the example, for instance, of the bioreactor bag that again, we have spoken about. We may be able to identify a code at HS6 level, but then when we go down to national customs classification, we can get up to between 16 to 55 HS digit type product lines in this national classification. So it is quite hard to pin down these products. For others, it's much more difficult to identify. For instance, we have had challenges in looking at specific equipment like pumps, filtration units, vial filling equipment, and so on. Then we have also an issue with up-to-date data. Good data at this HS6 level is, of course, generally available with a time lag. So then here we would need to consider drawing much more on national, maybe monthly trade statistics. And maybe as a last point, also to drill down to firm level. And I think the other speakers will speak about some of the initiatives in this sense. Then, of course, mapping out the bottlenecks or the choke points, but also the facilitating measures. Here, the policy environment is as diverse and as complex as the many components in supply chains. We have looked in our work, as also the WTO presentation mentioned, at tariffs, which come in different ranges from these inputs to capital equipment or material to administer vaccines. We have seen that NTMs have also a wide range of measures being applied both on exports and imports of vaccines. And these were all already in place before COVID. But with COVID, we saw much more measures being, of course, unraveled in this space. And again, both in terms of creating some of these choke points, but also facilitating measures as some that have been mentioned. And I would like to finish up just with mentioning on how maybe we can move from this snapshot type of information to more structured one. And this is important because it can help support open supply chains, but it also shows the value of international cooperation. We need to strike the balance between what we can cover now in a mapping, but also remain relevant in a dynamic environment. And dynamic environment means, of course, will we need boosters, new variants? Will we have new vaccines and treatments? What kind of inputs will be required there? But also maybe in case of unsuccessful clinical trials, will there be a relocation of these materials? So we not only need to think about what we need to cover as scope and what kind of measures are being applied, but also what kind of variables and indicators we want to track in this mapping. And it may not just be about traits. And I think the example that has been referred to before, such as the agricultural market information system shows, is that there may be other indicators that are important beyond exports and imports, but also production, supply, utilization, inventories, and so on. And with that, I'll finish up saying that, of course, with all these challenges mentioned, joint efforts are definitely needed between governments, private sector, international organization, and many other stakeholders. And we would be really happy to continue discussions in this work because transparency creates trust and trust creates cooperation. So I think this type of initiative is extremely important to move things forward. Thank you very much. And I'm looking forward to the discussion. Back to you, Suja.
Thank you so much, Silvia, and it's a pleasure to see you after a long time. I like very much your term lab to jab. I think that's a very nice term. And of course, you did highlight again the classification issues. And in fact, I think a number of schedules probably doesn't even go down to the detailed tariff line, but rather it sticks at the X outs, where you have to rely more on the description. So it makes it even more complex. And of course, you highlighted again the data issues. But I very much also appreciated your end note where you have the static and you have the dynamic, and you have to make sure that both work in tandem so that we can get results. So thank you very much for that. I have had a slight tap on my knuckles from the organizers saying, please try and ensure speakers respect their 5-minute limit. But as I did give a 1-minute extension to the WTO, I believe in non-discriminatory treatment. So I will give 1 minute just for anyone to wrap up. And thank you very much for doing your very best to respect the 5 minutes. So with that, I'd like to invite Chad Bown to take the floor. He's a Reginald Jones Senior Fellow. I don't think he needs, of the Peterson Institute of International Economics, and I don't think he needs any further introduction. So Chad, you have the floor. Thank you for being with us.
Thank you, Suja, and for the invitation to be here. I will respect my 5 minutes. So basically, let me start by just saying I think I share the sentiments that almost everybody has said today. So I'm going to try not to repeat too much, but just to say that all of the problems that folks have already identified, I'm completely on board with, and these are things that I've been trying to figure out myself over the last year or so. So what I thought I would do in my time today is to kind of walk through an example that I've gone through recently that's helped me pinpoint some of the challenges with data and then thinking through policy and how it is that it's more than just trade policy that we need to be worried about when we're thinking about these supply chains. So I've shared my screen. This is obviously motivated by probably the highest profile example of lack of cooperation or allegations of hoarding, scarcity, export restrictions, right? So if we think back to March and April, where there were shortages of various supplies, these accusations that the United States government had a ban on supplies that was preventing everybody else around the world from scaling up. And luckily, I'm in a position as an independent analyst not to be in government, so I don't need to be particularly diplomatic in staying away from such sensitive topics. But this is obviously really, really serious. And so for me as an outsider, you know, this is the concern with the abuse of this thing called the Defense Production Act in the United States especially. I went to the data. And so what I did with a project with Chris Rogers at Panjiva is they have access to, or they put together this database, not for all countries, but for a handful, including India, of really detailed company level data that you can use to then map back to who their suppliers were. So we wanted to ask the question, well, was there actually an export ban to the Serum Institute, to Biological E, of these critical inputs that they need to make the COVID-19 vaccines? And we looked at the data. The answer to that is clearly no, right? So each country had been receiving an increasing amount of imports from the United States from all of these key suppliers. And you can use this data to actually identify the input providing companies, you know, for the ones that are making the bioreactors, the bags, the filter, the media. So all of the industry players here, Merck Millipore, Sativa, Paul, Thermo Fisher, ABEC. And you can use that to kind of identify in the really detailed data, at least in the case of India, what the tariff line products were. And those are obviously incredibly important because, as Suja just mentioned, they're usually in the other category, right? And so you wouldn't know where to look until you've seen the companies actually classify them. So we use this to kind of just make this point that obviously there wasn't an export ban, but this does not resolve the underlying problem, of course, that there just are input shortages. So I think it's important to understand the supply chain. We've already heard a little bit about this morning, but to understand why this challenge arrived in the first place, why it's not going away, what we need to do about it in terms of policy, and just to understand its manifest in this situation that we find ourselves in, and why this requires obviously utmost trust and cooperation. So you think about what, for example, AstraZeneca has done, and they've managed to scale up a supply chain globally. But what that means is they now have essentially 10 companies around the world all doing the same thing that they weren't doing, you know, a year ago at this time. And the challenge is they're all going to the same input providers to provide them with the key materials, these specialized materials. These aren't just harmonized inputs that you can go and make in your basement, right, to do this kind of stuff. And even when you talk to the input companies, and this I found from Paul, which is one of the key input providers in this space, they describe this explicitly and say, look, we wanted to standardize the quick scaling up of production, and so this is how we did it. But what that means is it then locks in the input providers to these supply chains as well. So there's just not a lot of choice for all of these companies when they're trying to scale up. Same thing for Novavax. So what that's meant in terms of underlying, not trade, but domestic policy during the pandemic, and I know best about the experience of the United States that I've studied, has been two things. The United States has effectively done two things: Operation Warp Speed and the Defense Production Act. Operation Warp Speed, people know best about providing subsidies to all the vaccine manufacturing companies. But what folks also don't perhaps know quite as well is the United States also subsidized the production of input expansion. So to companies like Sativa to build out more capacity on their production of bioreactors and bags and cellular material, the companies that are making the syringes and all of those kinds of things as well. Now that's nice, but they probably didn't do it enough. And certainly other countries haven't done it as well. And so the challenge is when there are these shortages, you need to have the globally coordinated expansion of input production capacity, which is a challenge when we know that the input providers and the output providers are in different countries. And then in the period of time when there isn't enough of these supplies, how do you allocate them in a way that makes the most sense to produce the vaccines that can actually be manufactured today that the regulators have accepted, right? And that requires decisions, difficult decisions that need to be made, and obviously transparency too. I'm over time, so I'll stop, but let me just say that we've written a lot about this. And in my slides, I've got all of the references where you can go to learn more, and I'm happy to take any questions. Thank you.
Thanks, thanks very much, Chad, and sorry to have cut short your presentation, but certainly I had already read your paper and I'd found it quite fascinating because we had heard a different story here. So already with your first slide, it was very interesting, and of course you spoke about coordination, about taking difficult decisions in terms of allocation, but all of that is actually hopefully something that will come to the forefront following events such as this symposium. So thank you very much for your contribution there. And with that, I'd like to now turn to Mr. Ronald Antonio Buttiong from the Asian Development Bank. He's Chief Regional Cooperation Chief of the Regional Cooperation Integration Thematic Group, Sustainable Development and Climate Change Department. You have a lot to do in your portfolio. So with that, I give you the floor. Thank you very much for joining us.
Thank you, Suja. Fellow panelists, participants, good day, good afternoon, or good evening. First of all, I thank WTO for inviting ADB to this symposium and for having me as panelist in this important session. In December last year, ADB launched the $9 billion Asia-Pacific Vaccine Access Facility, or APVAX. APVAX provides a framework and resource envelope for supporting developing Asia's vaccine access using two complementary components. The Rapid Response Component provides support for critical vaccine diagnostics and procurement and transportation of vaccines. The Project Investment Component supports investment in systems for production, distribution, delivery, and administration of vaccines, along with investments in building capacity, community outreach, and surveillance. ADB has so far approved APVAX assistance to the Philippines, Indonesia, Samoa, Tonga, Vanuatu, Tuvalu, Afghanistan, Tajikistan, Mongolia, and Bangladesh. In addition, our private sector department's Trade and Supply Chain Finance program has also supported more than 5,400 COVID-19 related transactions worth over $4.5 billion to date. Given the urgent need for COVID-19 vaccines, ADB has been exploring ways to help increase their availability and accessibility in the Asian Pacific region, including strengthening the region's production capacity as well as logistics and distribution. In partnership with other international organizations, ADB wishes to help address choke points in the entire COVID-19 vaccine supply chain. We recognize that it is critical that trade restrictions and vaccine components be kept minimal and cross-border movement be facilitated with simplified and expedited processes. In our consultations with customs administrations in our member countries, as well as with the WCO, we were encouraged with the simplified processes that have been applied to the entry of COVID-19 vaccines. However, we note that the initial imports happened through the government-to-government channel and were facilitated in some cases through ad hoc measures, as Roy indicated earlier. With an increasing role of the private sector in the import of vaccines and their inputs, the import clearance process will need to be more robust and flexible, and procedures should be streamlined and sustainable, including for vaccine components. We intend to leverage our support for the Central Asia Regional Economic Cooperation Program, the Greater Mekong Economic Cooperation Program, and the South Asia Sub-Regional Economic Cooperation Program in strengthening trade facilitation measures for vaccine production and distribution. We wish to underscore that supply chain visibility, which this symposium is trying to promote, is important as it would help determine and compile existing tariff and non-tariff measures or barriers impeding their efficient flow. It will be a good starting point for targeted interventions on trade facilitation and for monitoring cross-border movements of vaccines and their inputs. We have embarked on a modest effort to help improve availability of supply chain information for vaccines and their inputs. The Trade and Supply Chains programs of ADB's private sector operations departments saw early on in the pandemic that commercial banks did not know which of their customers were involved in the supply chains for COVID-19 fighting products. To help these banks, as well as investors, governments, and others determine where help was needed in those supply chains, we developed a mapping tool and offered it free online in May 2020. More than 23,000 visits have been made to the site, which maps 34 products down to their component parts, including vaccines and cold chains needed to transport them. We would be very pleased to contribute to this effort of identifying critical inputs through this mapping tool and to collaborate with WTO and others in this regard. We would be happy to include in the mapping tool relevant information that will come out of this symposium and our further collaboration. Thank you once again.
Thank you very much, Ronald, for that, and certainly this information dissemination that you have referred to in terms of the mapping tool, I think is also extremely important and the next logical step once the data has been sourced and consolidated. So thank you very much. And I would now like to turn, I think, to our first. I had some news that maybe Phyllis, you may not be online, but perhaps we will give it a go and welcome you to take the floor and make your remarks. So if you're there, please go ahead. Thank you. Yes, you are. Great.
Good afternoon. I am here. I've actually heard all the speakers.
Oh, super.
So very, very pleased. Thank you so much for inviting me to be a part of this important meeting. I'm Phyllis Arthur with Bio and represent many of the companies that are working on vaccines and biologics in the space. I actually just want to take a few moments and talk about the importance of this area for continued vaccine development. We often hear at Bio from our companies that their concern is many of the items that probably Matthew Donham covered in session 2, but bioreactor bags and all the different consumables for tubing. We hear about the lipids for mRNA. We also hear many people having trouble getting the cartons and packaging that they need, which is a specialized set of activities as well. And of course, we hear from companies about key reagents needed for the manufacturing process. What's unique here is many of these items are unique to the manufacturing process. So while they are an overarching category, it's important to know the differences between even the bioreactor bags that are used by different manufacturers, unique to their process. One of the other things we understand is that the suppliers for these items, as I think Chad referenced, are highly concentrated to a number of firms that have global footprint. And so companies actually normally build redundancy into their manufacturing plans to make sure that they have several manufacturers on record with the regulators around the world so that they can facilitate access to these different products in case something happens. Companies have tried, because they know how important the global supply chain is, to manage their global access to different materials. We really are suffering from what is mainly just a doubling or tripling of the number of products we're trying to make. And so I think that Chad's point about the need over the longer term to invest in new suppliers is going to be pivotal to our success in this space over time. I want to just remind everyone that really starting to improve the free flow of goods will not just have an impact, albeit very important, on the manufacturing of COVID-19 vaccines, but many of these materials, as others have said, are used for biologics manufacturing and vaccine manufacturing worldwide. And so it's really important for us to improve the movement of these vital production supplies, not just because we want to have more COVID vaccines for all of the world, but also to make sure that we can continue to make the other vaccines we need for public health, measles vaccine, et cetera, around the world, and other biologics that treat cancer or rare diseases, often many of which that use the same materials. It's also important to make sure that we really move the free flow of these goods because, as someone else had said, companies are not just making vaccines right now for the current outbreak. They're also doing clinical trials and scaling up production for new vaccines that could attack the variants, that could actually serve as boosters. And so the more we can facilitate the free flow of these really important materials, the more we can have new products, next generation vaccines, and other materials that are going to be important for managing COVID-19 and responding to the next pandemic as well. I think that point that Chad made about our investment in suppliers is really important. We need to actually make sure that we are scaling up both the manufacturing of these vaccines as well as investing in the suppliers that make all the key materials we're focused on today, and that we're thinking about new suppliers in countries around the world who can add to our ability to surge manufacturing in the biologics and vaccine space. There's no question we've seen delays in the exports of materials, but some easing of supply has been happening mainly as efforts have been underway to facilitate the exchange of materials between manufacturers as needed. This is certainly not enough to solve the problems that we've been hearing about all day today. But the work of the COVAX Manufacturing Task Force has been helpful in identifying that broad set of materials that are needed. Bio is also a partner in the 5 Steps program, which you heard about from IFPMA. And we feel like one of the key tenets of that is the free flow of goods. And so we stand ready to work with the WTO, all the different members of the member states, many of the organizations that have been speaking today, to find ways to facilitate as much movement of material as we can and to make sure that we have visibility. So we're very supportive of this effort and think that it'll be extremely important to work together with you to solve the problems of exports and tariffs. Thank you for the time.
Thanks very much, Phyllis, and thanks very much for your remarks. And I think you also highlighted some of the points that have been made earlier, like identification of products, ensuring free flow, and very importantly, and I think this comes back to what Chad had said about the need to ensure that there is going to be that supply of inputs, given the enhancement of manufacturing facilities that's anticipated in the future. You do need to sort of make sure that everything works in tandem, and that's going to be the challenge. But thank you very much for your remarks. I would now like to turn the floor to Thomas Ellman, who is the Vice President, Life Sciences and Healthcare Custom Solutions Innovation from the DHL. So Thomas, welcome, and I give you the floor. Thank you.
Thank you, Suja. Can you hear me? Is it going well?
Very well, thank you.
Excellent, thank you. And thank you for giving us the opportunity to speak here at this very important event. I would like to give a little bit of perspective on supply chain and what for us at Deutsche Post DHL, it meant in the last 6 to 9 months to prepare and to basically roll out our campaign to support customers in the vaccine distribution. I'm sharing my screen here as well. I only have like 3 or 4 slides on that one. So DHL very early last year looked into the upcoming challenge, and we reflected into white papers on the overall situation. These are freely available on the internet. I would encourage you to download them and have a look. And we basically there alluded a little bit on what does that mean to ship -70 degrees vaccines around the world, for instance, right? We also founded a task force to go into the discussion at a very early stage with customers, and customers are basically both manufacturers for the vaccine, but not only vaccine, but also test kits, ancillaries, everything that is needed in the pandemic. And customers can also mean governments and NGOs. And we started the discussion to basically prepare very early to avoid any hiccups, any delays in the supply chain. Status today, we have shipped more than 340 million doses around the world. We are also engaged in domestic distribution in certain countries, but the main focus is on global transportation and obviously cross-border crossing. And we are doing this to more than 140 countries right now. What is very important is basically that our multifunctional teams in a very early stage got together with the representatives on the manufacturing side, but also in the destination country with the governments, the customs institution, with security. Obviously, that's a big issue in some countries as well. And you see the list here of all the things that we have built together and put together in a very early stage. And obviously, we're very happy to participate and give input with our knowledge and our experience to this working group here as well. So far, we can say the vast majority of these shipments went very well, very smoothly, nothing was held back, but also bear in mind, please, that the first time shipment of a vaccine to a certain country for a lot of countries was like a national event. It was like in the evening news on the front page of the newspaper. There were political representatives there, there were journalists, there were military police there, and guess what happens? Our plane has landed. The pallets or boxes have unpacked and went straight into the vehicle for the final destination. No holdback of any product whatsoever. We're just wondering, will people really remind that? And will that be the same for the 5th, the 10th, the 20th, the 30th shipment that needs to come in the next weeks and months to come if there is no Prime Minister or Ministry of Health present, if there is no journalist present, if that is a normal shipment, for to say, right? That is very important, we believe. And why? I mean, these are some of the slides from our white paper as well. The concentration of vaccines manufacturing is really concentrated in like 8 countries. It's now a little bit spreading out because the main manufacturers are reaching out to other CMOs in other countries as well, but it needs to go to a huge number of countries in order to speed up a high vaccination rate, not only in UK, US, Israel, Chile, that were the front runners, but in basically 200 countries around the world. So very important that cross-border crossing is allowed, and also, as other people before alluded, also the inbound flows of the pre-production and all of the base components and the material that are needed to make a vaccine, right? The other thing on the outbound I want to highlight is a little bit that obviously to have a successful vaccination process, there are 2 things that need to get smoothly and come together. The goods flow that we as a logistics company are responsible for, ensuring that you have the capacity, that you have the packaging material, that you have the coordination and the synchronization of flows. But obviously in the destination country, super important that you have a strategy there, a vaccination program, that you have an easy way to inform the people and to get them registered to go to the vaccination centers. And as we all know, for most of the vaccines, that is required twice. So there is a lot of work needed between the private sector and the public sector to basically ensure that this is a seamless and very well synchronized flows. And that counts especially now for the months to come for the countries of the low and middle income country area in Africa and Latin America and parts of Asia. So last slide from my side. And with that, I would like to conclude. If we like it or not, this thing here is stay for a little bit longer. And we need to get prepared not only for this year and next year. That's probably what also COVAX is saying, to distribute 10 billion doses also to low and middle income countries that will last into 2022. But what we see already today is we need to have booster shots. We need to have new vaccines that are adapted to the mutants. We have new groups of people who are eligible for vaccination, like children and so forth. So we see that there is here, according to our research, on top of the 10 billion that we need to ship this year and next year, there is something of a range of 7 to 9 billion that also we need to be manufactured and distributed in the years to come in order to basically keep us all safe and protected. And with that, I would like to end and give it back to you, Suja, and happy for any questions.
Thanks very much, Thomas. I'm hoping to take all the questions at the end so that that will allow the speakers to come in as they wish and respond to the questions as they wish. We're getting a few here already, so thanks once again to the other participants and audience who have posted these questions. So I'm hoping that, you know, the point you made about, you know, vaccines enjoying a free flow currently will continue into the future, especially in respect of the 10 billion vaccines which are coming this year, as well as the 79 billion that you think or you anticipate coming in terms of booster shots, in terms of also coverage of children in the future. So thank you very much for sharing your views. I would now like to invite Christian Piaget from IATA to hear about bottlenecks that have also been identified. So Christian, if you're online, please do take the floor. Thank you.
Thank you, Suja. I hope you can hear me.
Yes, very well.
Thank you. Indeed, I will go through the bottlenecks and also some of the things that went well. But maybe as a preliminary point, let me emphasize that the transport of vaccines by air and medical shipments is nothing new. So that's actually an important part of the air cargo business for quite some time. And thanks to that means we had the processes and the skills already in place for the transport of these vaccines. But of course, what is new is the scale of these operations to distribute vaccines to 7.8 billion people. And there are a lot of constraints when we carry this type of shipments. They require very rigorous transport conditions, as was just explained also by the previous speakers. Any mistake can severely damage this sensitive cargo. So we were expecting several challenges. Some of them turned out to be true, some others not, hopefully. That will continue like this for those who didn't turn out to be true. But in the case of actual bottlenecks, I classify them in three categories. There are first those linked with previsibility, secondly those linked with capacity, and thirdly those linked with technical or operational issues. So we start with the previsibility. Of course, in a business like ours, preparation is key. So our first problem was to understand when, where, and how the vaccines could be distributed. And as we all know, it was immediately clear at the beginning of this pandemic that nobody was prepared to manage a sanitary crisis of that global scale. We as individuals were not prepared, but the governments also were not prepared. There were no business continuity plans, no stocks in place to deal with such emergencies, no infrastructure in some places. So in short, nothing that was really prepared and that could provide some visibility on the way forward. And that was a big challenge at the beginning of these transports. And not only for the vaccines, but also for the medical shipments like PPEs, the masks and so on that were sent before the vaccines. The second big bottleneck is capacity, and that's still a problem today. Most of air cargo in some trade lanes, actually 2/3 of air cargo are being carried in the belly of passenger aircrafts. So most of this fleet currently is grounded due to the current restrictions in international travels. And that has created and still is creating issues with connectivity. Airlines have been very agile with this to compensate for this lack of capacity, even converting passenger aircrafts into cargo aircrafts, full cargo aircrafts. And this has gone with its own range of challenges, but in terms of safety and ground handling, etc. But it has turned out to be absolutely feasible, fortunately. However, as long as these travel bans continue to be the norm more than the exception, the grounding of aircraft is an important bottleneck that we still have to deal with. The third category of bottlenecks is the technical or operational issues. I don't have time to go through all of them, but just some of them, while technical, were actually really problematic. First, as I said previously, these are sensitive goods. They are subject to temperature excursions and various requirements that we need to align with to make sure that they don't get damaged. And that require infrastructure at departure, transit, and destination. In some remote areas, the appropriate infrastructure has been lacking. So we need to make sure that the airports are properly equipped to manage cold or even ultra cold shipments, and that is sometimes a concern. We have also an issue with the crews, which is still a problem in many places. It was crucial to recognize them as essential workers to make sure that they are not subject to quarantine requirements. Because if you block a crew for 14 days at destination or in transit, it's just impossible to move these emergency shipments, moreover with a reduced number of aircrafts. So that's also an important bottleneck to take into account. But there were also things that went well. Among these, I would like to really commend the World Customs Organization and the ICAO as well, because the cooperation with these organizations have been really excellent. The WCO has been very helpful in making sure that the border clearance could be streamlined as much as possible. The creation of the HS codes list that was previously mentioned by several speakers has been also very helpful to facilitate the proper identification of these relevant shipments, and that helped to facilitate the customs clearance and not to slow down too much these movements. Also, we could count on the ICAO to send some guidance to the members, for example, in relation with aviation security contingency measures. That was very helpful. And what we also found out is that paperless trade was very helpful. The use of IT was really something that helped us a lot. So we really hope that this will stay after this crisis. And also the public health corridors that have been created for the crews are things that we think need to be somehow maintained in a facilitation instrument for the future if we face a same crisis in the future. The last thing, I know I've exceeded my time, but just wanted to also raise the point of cyber attacks. We've seen that there have been cyber attacks against the whole supply chain, not only a cargo, but the whole cargo supply chain, vaccine supply chain, and we need to remain vigilant about this, because this could be also an issue in the future. And I now have to leave the floor to questions, but I'm happy to stay on the panel to answer those questions in time. Thank you.
Merci beaucoup, Christian. That was, thank you very much for identifying those three, the bottlenecks as well as things that worked well. That was very helpful. And then this new element of cyber attacks, which is sort of a bottleneck, I would venture. And of course, digitization of procedures, and certainly this whole paperless trading has become more relevant during the pandemic, especially during lockdowns. And we did see it from on a more personal level here at the WTO. It was very clear that's what helped us stay in business. So yes, I think that's very important. So thank you very much. So now I'd like to turn to the final speaker, Monsieur Gael, who is Senior Advisor from the International Road Transport Union. So Jens, if you're there, please do take the floor. Thank you very much.
Thank you, Ms. Mavroidis, for giving me the floor and for inviting the IRU to this really important meeting. For those of you who might not know us, the IRU is the World Road Transport Organization and the voice of 3.5 million companies providing commercial road transport and logistics services. Now, to the topic, looking at the vaccine distribution, and here especially the downstream transport, this went really, really well. These transport were operated by large freight forwarding companies under a lot of attention by the public and special treatment by governments. And Mr. Ellman, you said it nicely. And these are huge events when a plane arrived with vaccination, the cameras were on there. So, but you might wonder what's going to happen in the near future. Now, looking at the upstream transport, however, the picture looks quite different. We need to keep in mind that manufacturing of vaccine is a complex issue, and we heard this already a couple of times. Making a vaccine involves raw materials, stabilizers, adjuvants, and going further, manufacturers of these inputs need other materials such as glass tubing, rubber, silicone, and so on and so forth. And these products are mainly transported by road transport companies. And in fact, 80% of these road transport companies are SMEs. And here comes the first problem, the first bottleneck. These SMEs are actually fighting for survival. Last year, the road transport operators lost 500 billion euros in revenues. Insolvency indicators such as free cash flow and asset use are all in the dark red. 10% of companies went out of business and 30% of the companies reduced their staff. Now, in this respect, one needs to keep in mind that the industry already has to deal with a considerable driver shortage, and the transport of vaccine products is often a transport of dangerous goods. And one needs specially trained dangerous goods drivers, and these drivers are not there anymore. Now, to address this first problem, before talking about vaccine input, vaccine manufacturing and distribution, we need to keep the transport operators in business. And I have to state, from the road transport industry, we see very little support from the governments to make this happen. And we need the support. We need urgent action from the governments right now. Let's come to the second problem, the border crossings. IRU has done some in-depth research on the impact of COVID-19 pandemic on the industry, and we looked at governmental responses to the pandemic. Now, 72% of all measures taken by government that are related to cross-border movements of goods were restrictive in nature. And these include border closures, border crossing restrictions, uncoordinated COVID testing at borders, uncoordinated quarantine of commercial vehicle drivers, just to name a few. And just to illustrate it, let me remind you of the pictures that we saw just before Christmas in the UK, where more than 1,000 trucks were stranded in the UK because they couldn't go over the channel to France. And airfields were actually turned into parking lots. We have other examples in Tyrol, where drivers were standing in the cold to get tested, border closures in Argentina, and an ongoing complete closure for transit of Turkmenistan, which is more than a year now. Now, the worst is that these decisions for border restrictions are taken unilaterally. And you might wonder which of them are really there to fight the virus and which of them are more protectionist in nature. Now, the key message to address this second problem is we need global coordination. And this meeting here today is a good step. So we need global coordination from government, and trade facilitation is the answer, not trade restrictions. Now, let me come to the third bottleneck, the third issue, which is digitalization. Now, the pandemic has put a dedicated focus on digitalization, and the industry full-heartedly supports the digitalization as a building block in the global COVID-19 recovery strategy. The UN CMR Convention, which is like a waybill convention, and the UN Tier Customs Convention and their IT tools fulfill almost 80% of the WTO TFA. In addition, and this is really a striking example, the UN Secretary General strongly recommends to governments to use those conventions. I would like to quote him: "Innovative tools such as the UN e-Tier and ECMR system and other digital tools to allow exchange of electronic information without physical contact and facilitate the flow of goods across borders should be used." So there's a clear message from the top. However, here's the thing. Looking at the 14 countries who are in the upstream vaccination supply and looking at the acceptance of digital transport documents, 9 out of 14 have not ratified the ECMR protocol, and only one is fully using the ECMR protocol. The use of e-Tier application is extremely limited in all 14 countries. Now, the key message to the third problem is governments need to make best use of existing UN convention and the digital tools. Don't invest and create something new. The tools are there, make use of them. Now, to conclude, I've actually 3 messages. Now, the first one is to allow transport companies to do essential transport. We need to keep them in business. Governments need to support these companies. Number 2, governmental coordination at global level is absolutely needed. And number 3, governments need to adhere to existing UN conventions that facilitate transport and make best use of their digital tools. So these are really the key 3 messages that I would like to deliver in my presentation. From the IRU side, we are of course ready to work with the WTO to solve these issues. We're ready to work with the governments to address these issues. And of course, I'm ready to answer any question that there might be. Thank you for your attention.
Thank you very much, Jens, for your remarks. And again, I think that, you know, it's highlighting some of the bottlenecks, and I'm hoping that the sort of case that you had outlined about, you know, the lorries stranded at the border, that was probably more prevalent at the start of the pandemic than now, and that's something that one doesn't see so often today. At least that's what I'm hoping, but perhaps I'm wrong. So with that, we've come to the end of the presentations, and I must say it was incredibly enriching. And I would like to turn to the question and answer session. So we have about 15 minutes for that. There have been a few questions which have come, but it was very remiss of me because I never asked people asking the questions to also indicate who they were addressing them to. So I think it's a free for all. So whoever would like to jump in, please do. So we have a first question, which is about how do you avoid duplication of mapping exercises being conducted by different organizations? So, you know, where can we avoid this sort of duplication, which is extremely inefficient? I guess perhaps that might be something for the WCO, but again, I'm just, or I think, yeah, my colleague Roy would like to say a few words here on this. Roy, would you like to? Please go ahead.
Thank you, Suja. Just to reply very quickly to that, I think the identification of the products, it's something that, yes, began a bit organically in different institutions. And we acknowledged at some point that this is an issue, right? Because you have several different people working on the same thing without necessarily communicating. And then precisely one of the things that we're trying to tackle with this joint indicative list is precisely to try to work together, get inputs, get as many comments and information as we can from all the different sources, and try to have a really joint product where you compile as much information as possible. So this list is actually quite advanced. We are planning to release version 1.0 in the coming days, but we still need to have, let's say, some minor discussions, I think, with some of the other contributors, just to make sure that all the information we have in there is as correct as possible. But you can expect this list to be available in the coming days. Thank you. Sorry, before I give the floor, also just to note that we're trying to do the same with the bottlenecks, right? Because it's not useful to have 20 different lists of bottlenecks. So we're trying to compile as much information as we have from all the different sources in a single list, so it's easier to refer to it once you're trying to do work in this area. Thank you.
Thank you, Roy. I have another one here, which is quite general. How can regulatory issues related to safety, quality, and effectiveness be addressed to ensure increased vaccine uptakes? Any offers from the speakers? Would you like me to repeat that question? How can regulatory issues related to safety, quality, and effectiveness be addressed to ensure increased vaccine uptakes? Gail? Oh, Gail, sorry. Yes, I do see your hand is up. Please go ahead.
Thank you. Yes, this really is a multi-agency issue, as well as communications and social media and getting that message out there. But certainly from the customs side, we've been doing a lot of work on the enforcement side to ensure that fake vaccines, that anything of dubious quality is not getting through. There's been major exercise with our members to ensure that the nasty people who decide to profit out of these sort of situations don't. So we're certainly working on it from our side, but I think this is an area where we really need to work with the manufacturers, we really need to work with the health agencies, we need to work with the other IGOs to try and keep that information flowing about the safety of the vaccines and ensuring the people that the product that's reaching them is a good product.
Thanks, Gail. Any other comments from anyone else on this? No? Okay. There was a question on, can you expand on the issue of cyber attacks? And so I think that was Christian who had spoken of that. So please, would you like to just expand a little bit about that issue? Thank you.
Yes, I was expecting this to come up, and the thing is, I don't have actually figures to give, but we are working closely with other trade associations and partners in the supply chain, and some of these cyber attacks have actually hit the press, others not. What we understand is there has been attempts to block some software, so we don't know where this necessarily come from, and I don't think the airline actually has been the most impacted in the supply chain. I think it's really the pharma sector which has been impacted most. But my colleagues who are in charge of the pharma transport have drawn the attention on the fact that it's a concern and that we need to insist on the need to remain vigilant. Again, the systems are robust. We haven't seen any real blockage about this, but we need to be aware that there are attempts of blocking these supplies, and that was a call for awareness more than anything else at this stage. I again, don't have specific figures, but I know that partners in the supply chain wanted to draw the attention on the need to remain vigilant about this risk, which is apparently a serious risk for these transports.
Thank you for that, Christian. I have for Chad, and I guess this is a big question, Chad, for you. What should be done about the problem of too few vaccine inputs?
Easy. No, I mean, this is the hardest one, right? And so I think first you need to recognize the seriousness of the underlying problem. And it's shocking to me, and it's unclear to me why this has taken place, that the United States, and again, I'm American, but there's been no one more critical of the United States policy over the last 4 or 5 years than me. So, but this is one thing that at least qualitatively they did correct by scaling up and actually subsidizing input expansion. But I have scoured globally, and I've not seen that same thing taking place in Europe or anywhere else. Now, it may be that for many of these critical inputs, the production is located primarily in the United States, so it makes sense for it to only be scaled up in the United States. But if so, that's a challenge in and of itself, because the United States doesn't have sort of as an economic incentive, enough incentive to scale it up for the world unless the world tells it to do so. And we can wait for price signals to get there, as economists, or we could have policymakers get together and say, we actually need to coordinate on this. We need to get the United States to tell the companies that are geographically located there to produce more of these bags and filters and media and lipids and whatever the scarce inputs are. And the lack of actual investment, public investment cooperation in that particular space, I fear is what's ultimately going to hold up some of the scaling out of manufacturing capacity around the world. But there has to be explicit cooperation and engagement at the policymaker level internationally in these key vaccine producing countries to send those signals to make that kind of thing happen.
Thanks very much, Chad, for that. I have one for Silvia. How could stakeholders benefit from the sort of the mapping exercise that you had spoken about from lab to jab? How can it be kept up to date?
That's also, I think, a very difficult question, but it links, I guess, to what all the other different speakers have been talking about. Everybody would benefit from such a transparency exercise. So Chat was speaking about international cooperation between policymakers, but also about what the private sector needs to see as signals, so as to know exactly what kind of inputs need to be scaled up, but also how mass manufacturing of vaccines need to respond to that demand. So first, I think everybody would benefit from such an exercise, and then there's also this value of finding the right variables that we need to track. I was trying to hint to this in my speaking points earlier, but it really, I think, goes beyond just the trade, exports and imports in itself, but we really need to know where a production of a specific input is located, how much is being produced, how much that goes into the different types of vaccines, so as to know what we are talking about. So transparency is definitely an important issue, but it doesn't come for free. It needs all this kind of infrastructure between policymakers, between the private sector, so that we know what we are talking about. So there is definitely value in setting this up and then in keeping it up to date, in the sense that we don't know what variants we are going to be talking about tomorrow, what kind of booster shots we may be needed. We have seen that some clinical trials of different vaccines have been as successful as expected. So does that mean that there will be some relocations of material there? So I think we have snapshots of this information, but we really need to work together between the different stakeholders to bring it together, make it available, and keep it relevant and up to date.
I remember your words about transparency, building trust, and I think, of course, this issue of coordination, whilst absolutely critical, it's also very challenging. So that's going to be what's difficult. But I did notice that even at a very small level of national trade facilitation, we have these national trade facilitation committees which were set up particularly to coordinate amongst the various agencies and with private sector input, and they have been critical to trade facilitation agreement being implemented across the spectrum of WTO membership. So that's been very helpful, and so it's possible. But worldwide, I don't know, that's a different question. I think we're coming to the end of 5 minutes. I do have a huge set of questions, but what I would rather do is in the last 5 minutes, if there are any speakers who would like to make some few last comments, this is your opportunity to do so. But if you do wish to do that, please can you keep it really brief to give other colleagues some time also to speak. Anybody want to make any last comments? I see Thomas. Please go ahead, Thomas. And I see Chad then afterwards. Please go.
Yes, thank you. I mean, I believe if we go back a year, the world was looking at this big challenge of shipping these vaccines to 8 billion people and at very extreme conditions, -70 degrees and things like this. And that was new for all of us. We have shipped -70 degrees, but in small quantities only. I think now, being half a year in this whole distribution, we can see, yeah, we have done that. It's possible if we all work closely together, vaccines manufacturer, packaging suppliers, airline ground handlers, LSPs, but there is more to come. Therefore, we called our second white paper, it's a marathon and not a sprint. And we believe it can be managed, but what is utmost important is really close collaboration with all parties involved, especially between the private and public sector, because we still have a way to go, especially bringing products now to the people in the not so developed parts of the world. And that will be the challenge ahead. So that would be my message for you.
Thanks very much for that, Thomas. And Chad now, please go ahead.
So my last piece of advice is somebody who's been really trying to study this as an academic is for the world to look at the United States experience over the last year in scaling up its vaccine manufacturing supply chain and the record of government involvement, the recognition that with scarce input supplies, the government free markets isn't the answer, right? We could end up with a lot of these input supplies going to vaccine manufacturers that haven't been authorized for regulatory use yet, right? So we need government policymakers to help get things where they are being put to the best use. The United States has done this in a particular way through the Defense Production Act. Everybody thinks of this as just an export restricting exercise, but it's actually played an active role. The challenge is really going to be how you scale that up globally when it's not just one country thinking about itself anymore, but you have these scarce supplies that need to be flowing around the world to vaccine manufacturers around the world. There needs to be active government involvement and policymaker involvement in helping it get there. But it has to be done much more transparently and much more in a coordinated fashion with policymakers across governments. But I think you can understand and really recognize the underlying challenges to doing this by seeking to learn lessons from what the United States did over the course of the last year or so.
Thanks very much for that, Chad. And I see Phyllis also has her hand up, followed by Gail, but we have to be really brief because it's coming up to 1 o'clock. Thank you very much.
Actually, Chad said it beautifully. So I just want to reinforce the importance of that free flow of goods. And I think that Roy presented some really good options for member states to consider in making sure their trade policies move these goods around. And then we can all get together as the public and private sector and make sure we focus the rare supplies until we build up more suppliers on those manufacturing sites that are promised and producing doses right now. Because the pivotal thing right now is to get that 11 billion doses out the door to as many people as possible. And so staging these activities so that we're really focused on manufacturing right this minute in the sites that are approved, and then having more suppliers and more manufacturing ramp up, because we know COVID's not a once and done issue. It's got multiple stages to it, is the best approach. Right now, we put our heads down as a global community, and we focus on delivering those supplies to the manufacturers that are driving doses at the moment. Thank you very much.
Thanks very much for that. Gail, please.
Thank you. I just want to say one short thing. The one thing this virus has shown, and the fact that we're still in the stage of the virus that we are, is that borders are transparent to viruses. They don't see them, and borders do not stop the fact that the value chain is global, and any disruption anywhere in the world can affect all of us. So the thing we must keep in mind is that this is a global problem. It requires global solutions, and it requires us to work together. Thank you.
Thanks, Gail. And I don't see any other hands up, but I think that's a really nice note to end on. I would like to really thank all our speakers. They were absolutely brilliant. And for me, it was extremely enlightening, the whole exercise. And I'm glad that we will be able to capture a lot of this, because we will be posting all your, the presentations that did come in, but I do believe we may do a summary of the session and then post that, of course, clearing what we have summarized with the speakers. But I did want to say that, you know, as Roy had already mentioned, that we hope to get some tangibles out of the symposium. So we are working with some of the speakers here to have this living list of critical vaccine inputs, which we hope to consolidate and which we hope will assist countries identify what products need to be facilitated at the border. And we hope to release this subsequent to this event. And we also hope to have the equivalent kind of product for the bottlenecks and best practices faced by vaccine manufacturers and other stakeholders. So that's what we have in mind, but it depends on the content, because unlike, I think, the inputs, I think we have less information in terms of the bottlenecks and the best practices, but I hope that after the symposium, we're able to consolidate more of that information. So once again, with a real heartfelt thanks to all of you for taking the time out to attend the session, and to the audience out there who unfortunately I cannot see. I'm in a big room here with just 5 other of my colleagues, but thank you so much. It's been really a pleasure, and I hope that we will get the opportunity to meet in person in the not too distant future. Thanks very much. And the next session will be at 3 o'clock, and it will be speaking about the, I think, promoting transparency and convergence in the regulatory landscape, which is, I think, one of the questions which had come up during this session. So please tune in for that. That's at 3 o'clock. Many thanks again. Bye-bye. And for those in Geneva, bon appétit. Bye-bye.
Thank you. Bye-bye.